Hi, and thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, we're going to talk about the social injustices that we see in America. And for African American women, we're going to talk specifically about how you can advocate for yourself to decrease the likelihood of you having a complication during the pregnancy. But before we get started, please go ahead and click the subscribe button below. Subscribe to my YouTube channel so you can get all the notices on the blog updates and the videos as they come out. All right, so the death of George Floyd highlighted a lot going on in the country today. One is highlighted racism in the country. We've seen a lot of companies come out and talk about their stance with the Black Lives Matter movement. But more importantly, we have seen a highlight of the systemic injustices and racisms when it comes to health disparities in this country. COVID further highlighted that. We can see that people that are of African American descent or people of color have a far higher rate of getting infected with COVID because of issues with systemic racism and the likelihood that multiple generations of families live in the same household, therefore making it very difficult to practice social distancing. And we see that if you get COVID as an African American woman, you are more likely to die. We see that 70% of deaths in the U.S. are from people of color. Okay, so that's a big deal. And when we look at maternal mortality, meaning death in pregnancy or around the pregnant period, we know that African American women have a far higher mortality rate than any other ethnicity. And so, with these social injustices being highlighted, I think it's appropriate for us to have the conversation of what can we do to make sure we are safe during this pregnancy. If you're a person of color, the biggest thing you can do is advocate for yourself. Okay, so pregnant women that are of color are more likely to get gestational diabetes. They're also more likely to have pre-existing diabetes, more likely to have a hypertensive disorder of pregnancy, such as preeclampsia or HELLP syndrome, and they're more likely to have obesity. And so if we can control those risk factors, meaning obesity being the biggest risk factor in getting diabetes or high blood pressure, that in itself can decrease your risk. So making sure that you are at the healthiest weight you can possibly be before you get pregnant is a big deal. Also, making sure you are well controlled in terms of your blood pressure and your diabetes is also a way to decrease your chance of having a poor outcome in pregnancy. Preconception consults are just that. They're preconception, meaning you talk to an expert before you get pregnant. That way, that expert can tell you, hey, these medicines you're on are safe. These medicines you're on are not so safe, and so you need to come off of them before you get pregnant. Or your diabetes is well controlled, meaning your hemoglobin A1C is at a 6%. Or you need to work on your hemoglobin A1C before you get pregnant. Your high blood pressure is controlled or not controlled. There are certain medicines in pregnancy that we should not be taking. So lisinopril is not safe in pregnancy. If you have high blood pressure, you could be on that. Okay, that's not safe. That is something that's very first line in outside of pregnancy, and just not safe in the pregnancy. So making sure that you optimize your health before pregnancy is the biggest way to advocate for yourself. Okay, have a preconception consult. You can have an expert you ask all these questions to. They can tell you when it's safe for you to get pregnant. And then once you get pregnant, making sure you continue to ask questions. I always tell people, bring a notebook with you. Write down the things that your provider says and tells you to do so that you know to follow them, not just based off a recall, but you can actually look at the book and say, hey, this is what I'm supposed to do. Also, talk to your spouse. Some people are not allowed in the clinic right now because it's during the pandemic, so you may not be able to have a visitor. But right after that appointment or during that appointment, talk to that person that is your support person so that they can be reminders of the things that you're supposed to do. If you stop taking a medicine, please tell your provider, okay? Because they don't know that you stopped taking it unless you tell them. And they don't know if you're having a side effect of the medicine unless you tell them. So making sure you're very open and candid about how you feel with certain medicines, okay, and whether you're taking them or not, okay. Those are big things you can do to decrease your risk. And if you're having issues like a headache that doesn't go away with Tylenol, you need to let your provider know. This is not something that you just need to sleep off. This is something that you need to tell your provider, okay? Other things that you need to watch for. If you're having contractions and you're not in your late third trimester, that's a red flag. If you're having vaginal bleeding, that's not normal. Okay, there are certain things that can cause bleeding in pregnancy that can be deemed okay and safe, but anytime you have bleeding and that has not been evaluated, it's not normal, and so you need to ask. If your bag of water breaks, you could be in preterm labor. You need to make sure somebody knows about it. If you have a fever at any time during the pregnancy, you need to tell your provider about it. And so making sure you're asking questions and taking notes and following up, with your provider regularly, those are things you can do to decrease your risk. Postpartum. Some people see a nurse practitioner postpartum, which is fine. But if you're seeing somebody other than your provider, they may not know all of your history. So don't assume that somebody knows your history. Okay, always remind them of things. Okay, some people don't want to repeat themselves, or they'll say, "Haven't you read my chart?" Okay, there are certain things that are not glaringly obvious in somebody's chart. Okay, especially if you are seeing another provider for the first time. Those records might be faxed in, so they may have difficulty actually reading your records, or they may have difficulty reading a handwriting if it's written. Okay, so if somebody asks you a question, please answer it. Okay, some people even tell me, "Have you not read my chart?" I said, "I have read your chart, but I only have half your records." So, and then you don't want to know, you don't want to know that, because then you're like, "Oh, why didn't my OB send my records?" There's no reason to fuss or argue about those types of things. So if somebody asks you a question, just be willing to answer it again. Okay, there's a reason that they're asking you, and they're probably asking you for clarification to make sure that it's documented correctly in your chart. Especially if you're somebody that's young and healthy and you have a history of high blood pressure, they may ask you again, "Hey, who told you had high blood pressure?" or "When were you diagnosed with high blood pressure?" to make sure that what's in your chart is accurate. Certain things you should be on, and I usually don't tell people about medicine you should or should not take in pregnancy, but a couple things that will help you reduce your risk of getting a complication that can then cause you to have some issues. One, aspirin. If you're African American and you are obese, you should be on baby aspirin, which is 81 milligrams once a day, starting at 12 to 16 weeks, all the way through your pregnancy, every single day until you're about 36 to 37 weeks. That helps reduce your risk of preeclampsia. Okay, if you have autoimmune disorders, you should also be on aspirin during the pregnancy, unless you have an issue with your platelets or bleeding. If you have high blood pressure or diabetes, even if you're thin, you should be on baby aspirin to help reduce your risk of preeclampsia. Okay, and I say that because hypertensive disorders and bleeding or hemorrhage are two of the most common reasons that patients die in the pregnancy. And so I want to make sure that you're advocating for yourselves and asking your OB, "Hey, I have these risk factors. Should I be on aspirin?" If they tell you no, they should give you a reason why. Okay, especially if you have one of those things I just named off. Right. Making sure that you're getting your heart checked regularly. If you have diabetes in the pregnancy, before pregnancy, meaning you have type 1 or type 2 diabetes. If you've had type 1 diabetes, you should be getting an echo during the pregnancy. If you have type 2 diabetes and it's been over 5 years, you should probably also be getting an echo or at least an EKG to check your heart rhythm, because people that have diabetes can have silent heart disease. Okay, we don't want any complications of heart disease later on. So if nobody's mentioned those things to you, you have them, kindly ask, "Hey, am I supposed to have these things?" And I'm saying that because these are things that I've seen later on in pregnancy. People get these complications. And when I look through their charts, I'm like, why was this person not on aspirin? Why did we not know their heart function at the very beginning of pregnancy? So this way, you can advocate for yourself and ask questions, okay? I never encourage people to to follow Google MD, meaning don't Google your questions. Ask your provider, okay? They know your history. They have the conversations with you. They are experts in obstetrics. Ask them, okay? I am simply trying to encourage you to advocate for yourself so that you are not faced with complications later on. And if you do have them, they're promptly listened to and they're promptly treated. Okay. In your postpartum period, you can still get complications. Okay. 6 weeks after, if you're having issues, you need to let your OBGYN know. If you're having headaches, don't go away with Tylenol. You still need to let your OB know because you need your blood pressure checked, okay? If you check your blood pressure at home and it's still high, you need to let your OB know even if you've delivered, okay? Some people don't realize that after pregnancy can be a big deal too, okay? So we see a lot of complications that occur after pregnancy. So you are not out of the woods just because you delivered. So I will say and end with this. I am praying for equality for all of us. I am praying for safety for all of us. And I'm praying that health disparities will decrease in the U.S. Sometime in our future. But we need to do the part that we can do and advocate for ourselves so that we're not in the number of people that end up having major complications or even dying at the end of this pregnancy or after the pregnancy. So you guys be safe. Please continue to practice social distancing. You don't need COVID in the midst of all of this. If you are pregnant, you should not be out protesting. This is not the time. We can protest in different ways, meaning supporting Black-owned businesses or donating to causes such as Black Lives Matter or other organizations like the NAACP that support the efforts of African Americans. And finally, please wash your hands. We do not want to get an infection. We don't want to pass that infection on to our children or anybody else in our household. So the pandemic has not ended just because the protest is here. Lastly, I know I said I was going to end, but lastly, with all that's going on, whether you're Black, white, or yellow, you have been affected in some way by all of these protests, which I definitely think they need to be going on. I'm glad that we're highlighting injustices and having these difficult conversations about racism in America, but you may need to talk to somebody. It is overwhelming for me personally, to go work every day and talk about these issues and read on social media about these injustices. So if you feel like you are having anxiety or you're overwhelmed or you find yourself crying, please talk to somebody. Tell your OBGYN or your maternal fetal medicine provider or whomever your provider is about how you're feeling so they can refer you for some counseling. There's nothing wrong with asking for help. Please ask for help. One more thing, if you didn't click subscribe earlier, please click the subscribe button below and subscribe to my YouTube channel. Also, feel free to follow me on Instagram at pregnancy_pearls, and I'm also on Facebook at Pregnancy Pearls with Dr. Plenty. Also, don't forget to subscribe to the blog, which is at www.pregnancypearls.com. Bye!